vaginal hormones reduce the risk of urinary tract infections by way more than 50%. They reduce the need for antibiotics. Now, if you have an infection, you need it often treated with antibiotics. So this is preventative. This is like putting sunscreen on because you never want a sunburn, right? This is like putting your seatbelt on because you never want to be hurt in a car crash. And so the vagina and the bladder, when they don't have hormones, it gets thin, it gets raw, it gets irritated. And then if that person then tries to have sex, penetrative sex, think of what the friction and the irritation and the inflammation of doing that on a rug burn or on a sunburn, right? It's going to create a very painful, raw, and uncomfortable environment. And so it's really prone to urinary tract infections, especially after sex. And so all of that is preventative. I'm a big believer in prevention, right? We wear sunscreen so that we don't get a skin cancer. We put our seatbelts on so we don't have an injury. And so I am a big believer that sort of anyone over the age of 45 should be strongly considering vaginal hormones to prevent problems. That's not to be saying if you're now 68 and you said, oh my God, what have I been doing all this time? We've got you. We can help you. This actually will be fine. But it's one of those things is it's never been shown to kill people. It's never been shown to increase blood clots, cancer, heart attack, stroke. It has never been shown danger. The worst thing I see happen with vaginal hormones is in the first couple weeks as the microbiome acidifies and that acid starts to increase. Occasionally you get a yeast infection and we treat it. You keep going. The microbiome fixes itself, smooth sailing. Colleen and Bridget, we call this problem a little vaginal dryness, right? Oh, it's just a little vaginal dryness. Suck it up, lady. Use a lubricant, buy some crap thing on Amazon that's supposed to help you. You're okay. Suck it up. Y'all, this is not a little vaginal dryness. This is life-altering, life-changing. I can't wear pants. I can't wipe. I can't go out and go to the movies because I have to pee 40 times. I have changed. I can't run. I can't sleep. I can't go on long car rides. I'm getting urinary tract infections, needing hospitalizations, IV antibiotics. And they call this a little vaginal dryness.
You were talking about, women maybe in their 80s, 90s or more. And I have heard this from women saying, well, I don't know why my doctor wanted to prescribe me that because I don't have sex. So can you address that as well?
Thank you. Because I don't care if you are a nun listening to this conversation, because it is not, it's so funny. I'm a sex doctor. I love talking about sex, and I'm sure we'll get to it later. But here's one case where I actually think that this is my urology hat puts on here. And this isn't about sex, although using these products will make sex not painful, will improve your orgasm, will improve arousal. It's as good as Lady Viagra. Like, this is Lady Viagra, people. Like, this is the best thing ever. But the urinary symptoms are the thing that kills you. The frequency, the urgency, the getting up at night to have to pee, those things kill you. The urinary tract infections, if that gets through your blood, that can really affect your brain and your whole body and all of your other organs. And so it's really important to understand that it's not about sex, actually. You know what's so crazy is I've seen people present to my clinic where their only symptom, because they're not sexually active, their only symptom is constipation. And the reason that is because the tissue is so raw and irritated, uncomfortable, the muscles underneath, those pelvic floor muscles, are really tight. Think about putting your hand on a hot stove, right? Your body's going to pull away. So if your pelvic floor thinks you're in danger and that you're in pain, it's going to tighten. And so your rectal muscles tighten, which makes it hard to get the stool out. And so people have constipation and they go to the GI doctor, and guess who doesn't know anything about menopause or vaginal hormones? Your GI doctor, right? They have no clue. They've never heard of it. They don't understand it. And they don't feel that it is their responsibility to prescribe it or explain what's going on. Menopause, I like to say your gas tank is empty. So you got no fuel in your gas tank and you're expected to be a sex kitten. And you're like, how am I going to do that? Right. So what we try to do is just put some gas into your tank, and you can do that through hormones, right? So estrogen can improve libido. If you're not sleeping, then, again, that's got to get you sleeping. We have great data in menopause for testosterone therapy in women to improve libido. And so in men too, right? Testosterone helps libido in men, and testosterone therapy is incredibly safe for everybody. It's not that that serious. It's not that scary. It's just that we don't have an FDA approved product for women. And so everyone goes nuts about it. So we have to extrapolate. We use male testosterone and we kind of dose it at 1/10 the amount. So we extrapolate, but everyone goes all crazy about Again, here's a problem with gynecology. Gynecologists are not, they're taught estrogen is the only thing to care about for women, and women don't have testosterone. So if you tell a gynecologist to prescribe testosterone, they've never done it before. It's not comfortable. And again, if you're not comfortable, how are you going to be aggressive? Right? Remember, I'm aggressive because I'm so comfortable. I give men testosterone all the time. Like, testosterone is not a big deal. It's not that serious. And so to give 1/10 the amount of testosterone, not only am I comfortable, but I'm aggressive, right? And so that's the difference. And so you have to know about it. You have to know the tips and the tricks and how to get the male version. What gynecologist even knows what the male version of testosterone is? So by making gynecology the only person that takes care of women, we're hurting women. Does that make sense? So I don't blame the gynecologist.
Right.
No one taught them, right? Nobody taught them.